Yes, the VA does have two things. One, an automatic 50% rule for mental health and an automatic reevaluation within 6 months after receiving that 50% rating for mental health. If you get content from this channel, like, subscribe, do all the things. Real quick, two things. There's a free Nexus letter. We're going to have a live stream on July 1st of 2024 for that free Nexus letter and a DBQ for mental health from Dr. Sharma, a board certified psychiatrist. Second is we're doing a $2,000 giveaway at 50,000 subs. That's the goal that we want to reach here. Now, getting back to this automatic reevaluation, yes, it does exist, but this is for veterans who received a mental disorder that developed in service as a result of a highly stressful event is severe enough to bring about the veteran's release from active military service. So for those who are med boarded, this absolutely applies to you. If you're being med boarded for mental health within 6 months, the rating agency shall assign an eval of not less than 50, so an automatic 50% there, and schedule an examination within the 6-month period following the veteran's discharge. This is 38 CFR 4.129. Okay, so yes, you will receive a rating of 50% if you're med boarded for mental health, and yes, you will have a re-evaluation. Now, I know someone's going to ask, it'll be off the new criteria or the proposed criteria or the old criteria? We don't know that answer because the proposal is just that, a proposal, and it really doesn't even exist. So we're going to go off of the current rating, but you're going to be re-evaluated no matter what rating you receive. So if you receive 100% for mental health after being discharged, you will be re-evaluated at that 6-month mark, around about 6 months. If you're 70%, you'll be reevaluated, and you cannot be less than 50% if you're being discharged for mental health. So food for thought, when that re-examination comes up, you absolutely need to be on par with that mental health DBQ. Not to game to game. That's not what we do here. We submit evidence-based, truthful claims. But you have to understand what the heck is happening in here and articulate that to the examiner and to your providers for healthcare. The evidence here is going to be absolutely critical because it's difficult for a CMP examiner to go against medical evidence. So speaking with your psychologist or your social worker or your psychiatrist or whatever your healthcare plan looks like for you, that is going to be critical. It's going to be crucial for evidence for your claim. At that 70% mark, there are 3 symptoms that really differentiate from 50. 50 and 70 are kind of like a blob, and those who are rated at 50% but have some of the symptoms at 70, you'll find a little sentence in the decision letter that says veteran most closely associates with, and that's the 50% criteria. That's the VA's way of saying, hey, you're almost 70%, but we really feel like you're 50%. This is why you have to understand what the heck is going on. I'm going to be honest with you. Active duty service members, when I was active, and even when I left the Marine Corps, I had zero idea of what the heck was actually happening in my life that was a result of a mental health ailment, of a mental health disability. And I had no idea until I learned the process for myself. That's why veterans need to understand why and how the VA rates mental health. So those 3 symptoms to 70% that really distinguish themselves from the 50% criteria. Number 1 is the inability to maintain effective relationships. So if you have kids, a spouse, family members, whatever that looks like for you, I'm going to hone in on kids. If you have trouble connecting with them or sympathizing with them on an emotional level, and you're just kind of there as the parent that does things, you can't really provide emotional support, you can't sympathize and empathize with your children, that's going to cause a huge disconnect and bonding with your child. That is a symptom that you'll really find on that severe criteria for mental health, which is at that 70% mark. Another one is the frequency of panic attacks or depressive episodes. And so panic attacks that occur weekly, if you have multiple panic attacks per week, that is hands down going to push that into the 70% criteria. And if you have episodic depressive episodes, I'm sure there's a better way to say that, but it's kind of like a roller coaster where sometimes you're really, really depressed and you just can't get out of your funk. And there are times that you're on it, you're doing your stuff, and you're just kind of on this roller coaster. It can absolutely be episodic. I like to describe depression as kind of like the circle, okay? You have all this stuff to do, but you don't do any of it because you're laying on the couch and you feel like you're melting into that couch and you don't do it. And then more stuff piles on, but you can't do that because you have the stuff that you didn't do before. And it's just kind of this revolving cycle of you being depressed because you can never really accomplish those life tasks and those goals. Even day-to-day tasks like doing your laundry or going to work, things like that, they will pile up. And that will cause your, this episodic depression that you're going to go through. So those two, I'm going to rope panic attacks and depression into one. Those two symptoms are definitely clear for 70%. And the last symptom that really distinguishes, there are more, but the last one that really distinguishes 50 from 70 is suicidal ideation. Specifically, those with a plan, those who constantly think about suicide. And you have to be able to speak about this. And this is what sucks is, just think about it. You're having your mental health exam. You would be guarded. You're going to have your walls up and you're going to be guarded prior to speaking about these symptoms and actually speaking about your suicidal ideations and all the other billion little symptoms that come with that. It's going to be difficult. And if the C&P examiner does not lead you and kind of force that out of you, there's a solid chance that your symptoms are not going to be evaluated as they are during that exam. Hence, that 50% rating instead of 70. So you absolutely need to open up and be vulnerable. And I know it's easier said than done, but those two things absolutely have to happen during this mental health exam, especially if you're being re-evaluated for mental health based on the criteria that you were med boarded for a mental health or traumatic event. You will be re-evaluated, and the C&P examiner is going to hopefully do a thorough exam. And not only are you talking about your suicidal ideations or your panic attacks or depressive episodes or your inability to maintain effective relationships, but all of that evidence that you've had the last 6 months from leaving service up to now, of you speaking with your social worker, you're speaking with your psychologist, you're speaking with your psychiatrist, all that evidence is being thrown on the table during that re-evaluation and saying, hey, here it is. Now, this video is specific to those being reevaluated from a med board, but that same concept applies for any claim under any circumstance being either evaluated or re-evaluated. You absolutely 1,000% need to have your medical evidence in line for your disability claims.